6 people have died in an outbreak of the new coronavirus, which has now reached the United States. The Centers for Disease Control and Prevention has confirmed the first U.S. case has been detected in Washington state.
Remain indoors to the greatest extent to protect physical and mental health.
Weigh heavily on us, knowing that when we close the restaurants to dine in and we close all the bars, that it's going to mean that people are going to lose their jobs and a lot of businesses are really going to struggle. We know this.
And there's a recognition of our interdependence that requires of this moment that we direct a statewide order for people to stay at home.
We must enact an immediate stay-at-home order for the state of Illinois.
Hey, what's
Hey,
going on,
Joe.
mate?
How's it going?
I'm good. How are you?
I'm doing all right. I was at Cook County for a little bit, and now I'm at a different site, and it's it's pretty crazy what's going on. I think that you know there have been a huge reduction. There's been a huge reduction in people who normally come to the ED.
Yeah.
So like all these people who normally come in for very benign chief complaints like headaches or back pain or even like people who are drug seeking or people who, are like homeless who are just looking for like housing.
Yeah.
Who normally fill up the ED with, are just not coming in. So it's definitely decreased in that volume.
Mm-hmm.
And a lot of the fast track has decreased, like people coming in for minor like cuts or falls, things like that, have definitely decreased, which has definitely helped with the volume. But it's definitely balanced out with the COVID. Normally, our job as like an ED physician is to like stabilize someone and then admit them to the hospital. And sometimes normally we do have to bore them in our ED for an hour, a few hours. But like at the community hospital where I'm at, like a patient who was intubated for COVID and had like a cardiac arrest from it, I did a shift and I intubated them and resuscitated them. I left my shift. I came back the next day and they were still there.
My name is Eunice. I am working as a registered nurse in the operating room at Illinois Masonic Medical Center.
My name is Bram Hill. I'm an auditor in public accounting.
My name is Young Kim, and I'm currently an upcoming senior at Marquette University.
We do see a lot of patients affected by the coronavirus in the OR. However, we take all of the protective measures according to our strict COVID-19 protocol. And thankfully, our hospital has had enough personal protective equipment to keep our hospital staff and patients safe.
My company started making layoffs about 2 months after the coronavirus pandemic started in the US, and I was one of the employees that got laid off. Normally this wouldn't be much of a problem because it's pretty easy to find jobs in accounting generally, but a lot of businesses are struggling and can't afford to pay employees as much. So it's going to be a lot harder to find a job in this economy than it would be normally.
A challenge I had to overcome was studying and working remotely. Learning is especially challenging without being in the classroom or workplace.
I think the biggest challenge I faced was keeping my mentality clear because I always had this fear of bringing the virus home from work and getting my parents infected, which would be devastating.
If you come to the hospital and you see these people who are dying alone, their family can't visit them, their parents can't visit the kids can't visit their parents, spouses can't visit them, and people are dying alone, then I think people would have a lot more compassion about what's going on, and people would, be a little bit more hesitant to necessarily drop the quarantine and just jump back into their regular lives. Yeah. If I get the flu, I'm probably fine. If I get COVID, I'm probably fine. But if I get the flu and I spread it to someone who's elderly or immunocompromised and they get sick, that's why I get the flu vaccine. In the same manner, people should be quarantining themselves, not for themselves, not so that they don't get sick. It's so that they can quell and suppress, this pandemic for all the people who do rely on them to quarantine.